Well, thanks so much for inviting me. So I introduce myself. I'm Thierry Messana. I'm a heart surgeon, and I'm the president and CEO of the University of Ottawa Heart Institute, which for those who are not so familiar to this organization, it's actually the largest heart center in Canada. And so what I want to present to you is really the very innovative work we have done during the COVID crisis, and that actually has ramification beyond the COVID crisis to sustain cardiac activities in spite of all the pressures due to the pandemic. So we have used particular predictive tools to manage the risk of patients waiting at home because of the inability to get them into hospital due to the pandemic. And so we based on our large database that we have at the Institute, we were able actually to put up a tool that has very strong predictive value of death on the waiting list, as you see on the right side of the slide, and the observed versus predicted expected waitlist death depending on the heart surgery we would perform was very, very accurate. And we published this actually in the Journal of American Heart Association. It's a tool which is extremely simple. We called it CardioOttawa. We call it the COVID triage tool. So basically for each patient which is waiting for surgery, we have very simple information to put there, like the age, the sex, the height, the weight, the heart failure classification, ejection fraction, renal function, type of surgery, and then the software, the algorithm actually gives right away the probability of short ICU stay or prolonged ICU stay or probability of death during a waiting surgery. So actually, this has been exceptionally efficient on our operations. Just to give you an example, all other cardiac centers in Ontario had to reduce, were able to achieve during the full year of the first 12 months of the pandemic, only about 75% of their volume scheduled. They had a lot of cancellation and inability to predict in the middle of the COVID crisis. So we had a team reviewing this data every week, and we were able to achieve 95% of the volume. And for us, to tell you the truth, we had a huge financial bonus to that because the government of Ontario decided to actually to reward the centers who were able to manage both crises at the same time, which is the pandemic crisis and the crisis of these cardiac patients who were waiting at home too long because there was no access to the hospital due to the pandemic. And actually, they decided to give a 20% bonus to all the cases that were done beyond 50% of the predicted volume. So it resulted for the Heart Institute in a huge amount of millions of dollars of bonus that allowed us to be the only hospital ending with a surplus at the end of the year. So I think it was pretty good reward for a very minimal investment. We had the database in place. We had the scientists ready to do the work, and we had the clinicians very excited to do the work. So all of this together and the IT team coming together, it worked. And just my last slide is, so we have actually been very active in AI business during the COVID, and we have a strategy around AI, which is actually at the center of our strategy now, which is applying AI to all kinds of telehealth utilization, like automated calling system, triggered AI, triggered interventions in consultation. We are creating a synthetic data set like a virtual heart institute. And I just talked to you about the predictive models of acute events in hospitals. And we are tackling down the huge problem of multimodality cardiac imaging to avoid test redundancy. So I'll stop there, and I'm happy to answer any question.